So HIS stands for High Intensity Service, and it's a newly commissioned service by NHS England with the intention really to provide as much support as possible to veterans and their families in a crisis. I think the real benefit of the HIS is that it's not just the NHS. We've got Walking with the Wounded, the Ripple Pond, and we've also got STOLL, all working together with us.
How does Walking with the Wounded fit into the HIS team?
We've got people who are experts with housing, with budgeting, with claiming for benefits, retraining to get back into employment again, even down to sort of like family legal advice.
Tell me about Ripple Pond.
We're a peer support network. We support families who have a loved one with a physical injury or a loved one who is going through poor mental health.
STOLL is more about housing as well, isn't it?
We provide loads of housing for veterans and also veterans' families as well. We're already coming across some people that may need more suitable housing, and STOLL is exactly where we'd be looking to go with that. STOLL can also use the HIS and have a kind of cleaner pathway into that service as well.
We've got NHS clinical staff who would do some of the more psychologically focused work with people. Maybe they need to be linked back in with the veteran community. We're very much underpinned by lived experience experts like yourselves, and we've got veteran peer support workers in the team.
As the name suggests, I'm a veteran that has been through TILs, even had to stay in combat stress for a short while. Not only can I relate as a veteran to other veterans, I can also relate from mental health. Just go out and meet veterans that come through our service, reassure them, talk to them buddy to buddy.
We were picked because the expertise that we've got are going to benefit the people we're working with and help the team work.
We're really lucky at the HIS. All of us have got such a wealth of knowledge from our different backgrounds that we'd be able to do such good wraparound support for someone.
We talk and we kind of exchange hints and tips. Oh, well, there's actually this service that could help you, or have you tried speaking to your veteran about this or that?
We have regular meetings every day. Once clients' assessments have been done, we do risk assessments on the different environments, whether we're meeting them in a public place, meeting them at their homes, or meeting them in a hospital.
Within 72 hours, we should have had assessment 1 and assessment 2 done. Then we'll take it back to a multidisciplinary team meeting with everybody there.
When HIS was first described to me, I envisaged it as Avengers Assemble. They've all got an individual superpower and they're coming together as a team.
That's a really good example of it. Who's in this area at this time? We need 2 people to get to this person.
Utilising and kind of tapering what the best service for that veteran would be at that point in time.
Because often what happens is, you might go to one service and they say, okay, we're trauma focused. You go to another one, they say, we're about alcohol use. What we're trying to do is bridge the gap. So if people are falling between services, we can get on the phone to them and try and get people working together.
This has been like one of the most useful things about the project. We get such fast and effective advice. It really saves time. It's just way more effective for the client as well.
Hopefully get the person away from being in a crisis situation where they might have to be admitted to a hospital. And then if they need longer term care with another team, then we find them the support that we can then link people into on a longer term basis.
It's all very well of me being empathetic and compassionate towards individuals, but them having someone who understands exactly what they're going through has just been so helpful. We've partnered up on a few of our clients, me and Gareth.
A lot of them are a bit reluctant to seek help. Either they're embarrassed or ashamed to ask for help. Really reassuring to them to know that there's other people that have had similar experiences.
The benefits of having someone who can just speak right on their level, where they don't feel like they're being judged and they feel like they're understood. It's the best bit about this project, I would say.
Families are very much part and parcel of trauma with veterans. The question is, what support are they getting?
The Ripple Pond will offer separate consultation and assessment for anyone who might be caring for that veteran.
And we do have a lot of people sharing, my husband, my son, they don't open up to me. They've locked themselves away for 4 days. I don't know what to say. If there's not someone there for you, there's not someone to pick you up, and there's not someone to say, we understand, we get it. It does get better. It does get easier. And this is how we've achieved it. It could probably be quite easy just to walk away. What our members do for each other is be there at the times when things are just really, really difficult.
I said, I want to show you what soldiers are like. We're going to get there 20 minutes early. Now look out the window. And he went, I can see him. He's hiding behind the bush, looking at his watch. I said, yeah, he wants to come in dead on 2 o'clock.
The famous 5 minutes before a parade.
This morning, my first appointment, I thought given an hour would be loads of time, and I was supporting someone to get there. No, he wanted at least an hour and a half, 2 hours.
We can take a referral very quickly. You can refer yourself, or your family can refer you, or you can come via a professional. One of the benefits of using the HIS is that we respond very quickly. Within 6 hours, we'll have checked out your referral, and within 3 working days, we'll have been out to see you at your home.
Each week we're getting busier and busier. The more people hear about us, the more different organisations are referring into us.
Unfortunately, some people might be in a police station or at a hospital, and we can get out and see you wherever you are.
I think I had to wait a month for a diagnostic, and that was a period when I really need to talk to somebody. What's going on? What's the process? Am I okay?
If I had the help that I'm giving to veterans when I was struggling, my road to recovery would have been a lot shorter.
My husband is in the army. He was injured in Afghanistan in 2010, supporting military families, veteran families. It's just such a passion of mine. I think it's such an incredible group of people to put up with what they put up with and to do what they do. And I just think being part of that community and being able to offer support is brilliant.
Are you from a military family yourself, Vicky?
I am. My dad was in the RAF.
I wouldn't say that's the military then, would you?
I know. Everything that we do with each of our veterans are all different personalities. They all work and understand at different levels, all have different things going on. We will put in place a care plan for them, and their care plan is tailored personally.
So we're saying to the guys out there, speak up. The troops are there ready to support you.
The sooner someone comes to us, the sooner we can get them on that positive journey. The longer you keep it in, the longer it will haunt you.